Welcome to This Week in Endocrinology. This week we're covering 5 notable papers spanning diabetes cardiovascular outcomes, the management and safety of antithyroid drug therapy, and the long-term systemic mental health burdens of endocrine disorders. Let's dive in. We begin with cardiometabolic care and the evaluation of oral semaglutide. In a post-hoc analysis of the SOUL trial, researchers investigated whether baseline characteristics or in-trial changes in glycemic control and body mass index modify the cardiovascular benefits of oral semaglutide in adults with type 2 diabetes and atherosclerotic cardiovascular disease or chronic kidney disease. Following over 9,000 participants for a median of 47.5 months, the trial demonstrated that major adverse cardiovascular events were reduced by 14% overall, but these benefits were significantly influenced by baseline glycemic status. Specifically, risk reductions were more pronounced among participants with higher baseline hemoglobin A1c levels and greater in-trial reductions in hemoglobin A1c tracked with larger decreases in cardiovascular risk at weeks 13 and 52. By contrast, changes in body mass index showed no significant interaction with cardiovascular outcomes, indicating that the cardiovascular protective effect operates independently of weight loss. Turning to thyroid disorders, several key studies illuminate the complexities of managing antithyroid drug therapy, safety monitoring, and drug switching. In thyroid, investigators evaluated whether shorter antithyroid drug courses of less than 12 months are non-inferior to standard 12 to 18-month regimens for relapse in patients with Graves' disease, who present with lower baseline thyrotropin receptor antibody levels between 1.8 and 10 international units per liter. Using propensity-weighted real-world analyses, the study found that relapse rates at 12 months were 17% in the shorter duration group, compared to 20% in the standard duration group, meeting an exploratory 10% non-inferiority margin, though strict 5% non-inferiority was not confirmed. Long-term relapse outcomes and restricted mean survival times over 60 months were similar between the groups, supporting individualized, antibody-guided treatment durations while highlighting the need for prospective randomized trials. Safety monitoring remains paramount when utilizing these agents, particularly regarding hepatic and hematologic adverse events. In the European Journal of Endocrinology, a retrospective cohort study utilizing TriNet-X examined the risk of significant liver enzyme elevation after switching between methimazole and propylthiouracil in patients who developed hepatotoxicity within 4 months of initial therapy. Among 276 patients switching from methimazole to propylthiouracil and 82 patients switching in the reverse direction, significant liver enzyme elevation occurred in 40% and 30% of patients respectively, with cholestatic patterns predominating. These findings demonstrate that significant hepatic injury following a drug switch is frequent, underscoring the necessity of close biochemical monitoring. In a parallel pediatric investigation, researchers evaluated methimazole-associated neutropenia and granulocytosis among 432 pediatric patients with Graves' disease. Over a 12-month follow-up, 24% of patients developed neutropenia, with nearly 85% of those cases occurring within the first 3 months, and the vast majority arising in the initial month. Multivariable analysis identified thyroid peroxidase antibody negative status as a risk factor, while older age and higher baseline absolute neutrophil counts served as protective factors, reinforcing recommendations for frequent neutrophil monitoring during the first month of therapy. Finally, we examine the systemic neuropsychiatric impact of endocrine pathology. In the European Journal of Endocrinology, researchers conducted a nationwide matched cohort study utilizing the Clalit Health Services database to evaluate treated mood and anxiety disorders in 540 patients with endogenous Cushing syndrome compared to over 2,500 matched controls. Evaluated through effective drug dispensations over a median follow-up of 13 years, patients with Cushing syndrome exhibited nearly twice the odds of receiving effective medications at baseline, with a persistent 2-fold higher risk of new-onset mood and anxiety disorders throughout follow-up. Crucially, this elevated risk persisted even among patients who achieved disease remission, emphasizing that clinicians must maintain vigilance for long-term psychological distress, regardless of biochemical cure. If you only have time for one paper this week, make it the post-hoc analysis of the SOUL trial in the Journal of Clinical Endocrinology and Metabolism. It provides actionable clarity for diabetes management by demonstrating that cardiovascular risk reduction with oral semaglutide is driven by glycemic improvement rather than baseline or in-trial changes in body mass index. Here are the key takeaways from this week in endocrinology. Oral semaglutide reduces cardiovascular events in type 2 diabetes, with greater benefits seen in patients with higher baseline hemoglobin A1c and larger glycemic reductions, independent of weight loss. In Graves' disease with lower baseline thyrotropin receptor antibodies, antithyroid drug therapy of less than 12 months shows comparable relapse outcomes to standard 12 to 18-month courses. Switching between methimazole and propylthiouracil carries a 40% and 30% risk of recurrent significant liver enzyme elevation, demanding close monitoring. Pediatric patients initiating methimazole require frequent absolute neutrophil count checks, as nearly 3/4 of neutropenic events occur within the first month. And finally, endogenous Cushing syndrome is associated with a persistently elevated risk of treated mood and anxiety disorders that persist long after successful surgical or medical remission. That's your roundup for this week in endocrinology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence which can make mistakes. Always review the original source materials.